Dear Excellencies, I start with my typical initial Excellencies, distinguished delegates, and dear colleagues. Hello, my name is Magister Christoph Fasching. I'm a psychotherapist in Vienna, and I represent the Elternkreis Wien, which is an organization that supports relatives of people affected by addiction. It's a great honor for us to host this side event. In my daily work, I see clearly drug policy is not abstract. It affects health, families, and social participation, and ultimately human dignity. It touches fundamental human rights, especially the right to health, protection of family life, and the principle of non-discrimination. Today, I would like to briefly highlight 4 concepts that are central to responsible policy making. First, evidence comparability. International drug policies relies on data and research, but evidence is not only truly useful when it's transparent and comparable across countries. Different definitions or methods can easily lead to misunderstandings, and comparable evidence creates clarity, and clarity enables constructive dialogue. Second, governance of access to knowledge. Research is not automatically accessible. Whether it can inform policy depends on infrastructure, transparency, and international capacity. One example is drug checking. Drug checking is not only a health intervention, it also provides anonymous information about purity, substance contents, and new compounds, offering a public health perspective on developments into the illicit market. Third, is epistemic justice. In multilateral processes, fairness also means that countries participate with comparable knowledge foundations. The goal is not agreement on policy positions, but fair conditions in access to evidence. Very important. Fourth, policy preparedness. New substances, changing patterns of use, and emerging health risks require forward-looking responses. This requires monitoring, evaluation, and access to reliable research. In Austria, there's currently a social initiative, a civil society initiative called the Vienna Declaration 2.0. It represents a national effort, or it's our national effort, to align drug policy more closely with human rights, public health, and evidence-based decision-making. The key points include decriminalization of people who use drugs, stronger use protection and prevention, regulation or regulated controlled access to drugs instead of uncontrolled black markets, expansion of harm reduction, counseling and treatment, and stronger support for families and relatives. Regardless of specific policy models, this initiative reflects something important. Societies all around the world are searching for better ways to connect health, human dignity, and public safety based on transparent evidence. When we strengthen access to comparable evidence, we do not only improve the quality of policy decisions, we also strengthen trust in institutions, in dialogue, and in multilateral cooperation. Thank you for your attention.
Good afternoon. I'm Michele Worobiec, and it is an absolute pleasure to be able to moderate today's panel. My background is in policy and also system development, so I have worked for decades in making sure that individuals that are in need of prevention, treatment, recovery, and continuity of care services receive that, including when they're involved in the justice system, and ideally as an alternative so they can remain in community and receive services. I'm also quite active with frameworks and legislation, and particularly trying to keep ahead of the synthetic drug threat and novel psychoactive substances that are making our policy work even more complicated. And so this topic is near and dear to my heart. We all want to rely on scientific and evidence-based practices that are effective and known to work, and the evidence is growing quickly. So I look forward to hearing from our panel members as they share how we can incorporate evidence and data into our practices and make sure that we have timely access to everything that we need to learn to do our very best work. So during the session, we will highlight critical foundational elements required for effective drug policy. Our speakers will begin by exploring the need for the evidence systems in national drug policy, move on to human rights and access to medications. They'll talk about the interpretation of scientific evidence and public debate, And finally, research infrastructures that improve access to global research. So allow me to introduce our first speaker. To my right, a couple seats over, we have Tuukka Tammi from the Finnish Institute for Health and Welfare. He is the associate professor and lead expert in health and social policy. His work focuses on the use of evidence in policy formations, prevention and harm reduction strategies, and institutional evaluation, with a particular emphasis on how governmental agencies translate research into operational tools and public communication frameworks. So, Tuukka, I will give you the microphone, and the floor is yours.
Yes, good afternoon, also on my behalf, and thanks Martin and David and others behind the side event for having me. Trying to say something quite general about the relationship of research and evidence and policy, and also do some considerations whether drug policy field is somehow specific or different from some other fields. So I hope it kind of lays the ground for the discussions today afterwards and for other presentations. Michele said I'm working for the Finnish Institute for Health and Welfare, and that is a rather big public health agency with lots of functions, from laboratories to social sciences and so on. And I'm a social scientist myself. From my background, a sociologist, and been doing drug-related research for a long time in different positions. If we think very generally the relationship between evidence or data or research in one corner, and then the political or policy-making end where this might be used, the evidence, then we need to add a third component to that triangle, which is something that could be called institutional capacities, or some actors that filter the evidence or data to policy level and package it and do the, let's say, science communication in between. From kind of a threefold approach, we talk about the, let's say, I think it's a little bit complicated relationship between evidence and policy making in the drugs field. You might disagree, but there should be the evidence-based, the data, and they say that the data is power. If you don't have data on something, it doesn't really exist, or then something else is replacing it as an evidence. It can be values, it can be stories, rumors, understandings of the kind of lay understandings of the same phenomenon. So to have evidence, you need to have data, and it needs to be analyzed and so on. And our institute is what they call the focal point of the Ratox network in Europe, meaning that we deliver lots of data on the Finnish drug scene reality services to Lisbon, to EUDA, but also, of course, use the same data for our own purposes. I have some background also for many years doing monitoring on the European harm reduction services in almost 40 cities. I've done that for Correlation European Harm Reduction Network, not anymore, but for 6-7 years. So, and in that, starting that monitoring of NGO-based harm reduction services, the state of affairs, that what they are capable of doing, what they have, the very idea behind was that this data is power. If you can't systematically kind of draw the picture, what's the situation of harm reduction services in Europe, it's very hard to kind of also advocate changes and so on. Like I wrote to the slide, despite having strong kind of data traditions or databases, it doesn't automatically mean that it would be translated to policy. There needs to be something in between. And what kind of barriers that there might be in between the policy making or political level and data. Drug policy is very I'd say, sectorally fragmented field. We have lots of actors in different countries. It varies which one is kind of leading the drug policy in Finland. It's officially the Ministry of Health and Affairs. In some other countries, it might be the Ministry of Justice or something like that. But in at least in most Western countries, all the sectors are involved and might be, or in unfortunately, in many realities, they also live in their own silos, more or less, and the kind of collaboration structures might be there, but if the policy is one coherent entirety, that's not always the case. And then, when talking about evidence, different actors in the fractions might stress different parts of the evidence that is see it more important than the other part. So that's all, the first problem, that not all the evidence is always regarded as a whole. And then it might be that not all the kind of, beneficiaries or stakeholders, people who would need the data or the knowledge, don't have equal access to it. They don't have equally analytical capacity to refine it or make interpretations out of it without help. And then, of course, reporting structures have lots of relevance also. If you have a kind of ongoing reporting system, then it's more likely to also be noted and paid attention to in policy level. What I would raise as there are many other points also, but some ideas how the policy research or policy evidence relationship could be made better. That first we would need to kind of take one maybe step backwards and see what's the whole field of evidence, what kind of evidence we have at the moment, what might be lacking from the variety. So going back again, that if there's no data, if there's no evidence, then it's always in a weaker position, that kind of phenomenon or part of the system. So again, using the harm reduction services monitoring in Europe as an example, it was clearly under-researched, especially on a kind of city level, regional level. What we have in Europe by the EUDA is mostly national level pictures of the situation, but as we all know that there are big differences inside countries and inside regions when it comes to state of affairs. And then the, let's say, the coordination or governance structures that we have in drug policy in Finland, I would say it's rather good. We have a drug policy coordination group where all the sectors, are represented, and it's meeting quite frequently, and also always new evidence, new research is discussed in that group. So these kind of forums are definitely needed to reduce also the fragmentation of the field and to discuss the kind of conclusions from the evidence. So this is also about strengthening cross-sector coordination. And by this, we of course support evidence-informed decision-making. And what I mentioned in some of the bullet points, I forgot to say what is, I think, quite specific to the drugs field compared to many other, let's say, health and social related fields is the political nature of this issue. It's quite frustrating sometimes when you show evidence and then it's politicized so heavily that it doesn't really matter what you say because they have their ready-made opinions already there. Yeah. So I think I end here. Thank you.
Thank you so much for that presentation. those comments really resonated. And when you looked at me and talked about the Ministry of Health and the Ministry of Justice, social services, the Interior, they all touch on the work that we do, but they use different languages, have different confidence in the data. And so I really appreciate where you're giving us a pathway to bring all of this together, to move beyond those barriers and to have more coordinated efforts. So thank you for your presentation. Next, we would like to introduce Katherine Pettus with the International Association for Hospice and Palliative Care. She is the Senior Advocacy and Partnerships Director at that organization, and also the founder of the Interfaith Advocacy Coalition for Palliative Care. She has extensive experience collaborating with civil service and civil society organizations and policymakers at the international level, regularly participating in United Nations forums, and promoting the responsible use of verifiable information in global health frameworks. So with that introduction, allow me to turn the floor over to Katherine.
So thanks for the fact-based presentation. Mine is going to be more theoretical because I'm a political theorist as well as an activist. So thank you to the Rome Consensus, of course, for inviting me to present today on behalf of the International Association for Hospice and Palliative Care. As a non-state actor in official relations with the World Health Organization, and a civil society organization in special consultative status with ECOSOC. I'm going to give a brief political theory-based overview of our advocacy work, which is grounded in the multilateral normative framework constructed after the Second World War. So briefly, the IAHPC, my organization, was set up more than 20 years ago to build a global palliative care movement. We have more than 1,250 members in 139 countries, and they are palliative care professionals who provide us with the evidence and the evidence-based research from the front, basically, for our advocacy and education work. And as you can see from the map on the right, which is also used by the INCB with the purple coloring, the vast majority of people in the world lack access to essential palliative care and other medicines that are controlled under the drug control conventions that are taken for granted in high-income countries. And there's no question that the bloated continents like North America, Australia, they overuse opioids. It's not a rational use necessarily, but the stick countries are the ones where there's really defective use or no use at all. So this is a question of inequity, basically. So this means that patients and their families suffer unnecessarily as a result of outdated, non-evidence-based, ideologically driven regulatory systems that are based in 20th century assumptions. And as an advocate, because the treaties were drafted, as you all know, and adopted in the 20th century, and palliative care developed in the 21st century. So as an advocate, I represent our members and their patients at CND and other places, and I'm delighted to partner with organizations such as the Rome Consensus to advocate for more humane drug policy, as suffering and dying in extreme pain and suffering, as some of you have seen, in the 20th century, when essential generic medicines are available, violates and outrages our moral, ethical, and legal sensibilities. So, what next one? Thanks. So this problem stems in part from the fact that palliative medicine, as I just said, which is an evidence-based clinical specialty whose cornerstone analgesics are included in the schedules of the drug control conventions, as well as the WHO Essential Medicines list, palliative medicine developed as a medical specialty well after the international drug control conventions were adopted. So we've got this asymmetry in evidence. And we've had to work with member states to develop guidances and model laws on controlled medicines availability since the beginning. There was no agreed language when we started. And all these binding conventions on the slide, on the left side of the slide, both the rights to life and the right to health, which are the foundation of palliative care and essential medicines availability advocacy work, they are placed in the right to health as well. So we have to build our house of advocacy on rock rather than on sand, and that rock is evidence, multilateralism, no matter how much attack it's under right now, international law, and evidence, or wishful thinking. We build it on evidence and on international law. Thank you, David. So the UN Charter authorizes this work, and many people don't really know that the UN Charter explicitly authorizes civil society to work by participating in ECOSOC, which is why you have to be an ECOSOC organization to actually attend, because it recognizes how much we add value to the discussions between member states in the international organizations, because we represent active professional groups in key social sectors with lived experience who are key informants to our research. And our effective participation can help generate political consent for policies, can help with the gathering of evidence as well as with its implementation, monitoring, and evaluation. And especially with new clinical approaches such as palliative care, which entails access to and affordability of essential controlled medicines, governments simply don't have the technical wherewithal or the capacity to provide the services they need. They have to partner with civil society and with academia to fulfill their international commitments to ensure availability. So civil society involvement can help governments to develop legitimate policies because we can together co-create an evidence-based foundation endorsed by neutral academic experts. Legitimate policies reiterate agreed language or co-create new agreed language, as we've done with palliative care, but it's always aligned with the existing normative framework and human rights framework. The objective of framing and implementing legitimate policies is ultimately a security objective, which is the concern of most countries, because legitimacy is closely bound up with consent and compliance of affected populations. And I'll tell you, just about 100% of the world is an affected population when it comes to palliative care, even though people don't want to think about serious illness and death and dying. It's still 100% of most sentient beings. So by definition, policies that command consent entail less coercion and reflect civic trust in the existence of social capital, which is a key resource for representative governments. Compliance is not evident on the streets in several countries and cities in the world, as has been seen in the news recently, where law enforcement has been using deadly force and violence, has been the order of the day. That's not compliance or consent. Legitimate policies entail less rather than more coercion and ultimately protect security. And at the national level, you need all these factors to come together to collaborate for legitimate and sustainable policy. And finally, this is my takeaway message, legitimate policies are evidence-based. They entail meaningful consultations with and effective monitoring by civil society, affected populations, and implementers. They're authoritative when they reflect consent, and they support civic trust and national security. So thank you.
Thank you so much. Being the timekeeper is the not very fun part of being a moderator, but it gives everyone a chance for their presentations. And your point that we have some outdated frameworks that need to evolve to really address these new situations is something that we've been hearing throughout CND, and I'm sure we'll continue to hear over the next couple of days. And I appreciate the very specific way that you illustrate the invaluable relationship of civil society organizations and making sure that these policies and their implementation are well informed and they ultimately have the impact that we need. So thank you very much again for your remarks. Next, I would like to introduce David Bruna, who serves on expert committees and is also an advocacy officer. He is a philosopher and public policy analyst with experience in citizen security, youth development, and civil society government coordination. He is currently pursuing a Master's of Science in Politics, Economics, and Philosophy at the University of Hamburg with a humanistic focus centered on human dignity. And I will also mention that he developed these materials in collaboration with Andrés Pérez-Acosta, who is a psychologist and full professor at the University de Rosario in Colombia. So without further ado, we will turn the mic over to David.
Thanks, Michele, and good afternoon to everyone. Yes, I will talk on behalf of Professor Pérez-Acosta and myself, and we will share some academia reflections about the topic of this side event. Well, every day we have more and more data, but only data makes sense through scientific interpretation. The inferences drawn will depend on the interest motivating the specific research and its potential usefulness, with a strong basis in reality. At this point, when we talk about interpretation, it's natural biases to rise, which can affect the neutrality and seriousness of the research. However, this situation is not entirely negative. So it's not bad by itself, because biases will always exist. We have to be clear of that. But this one must be transparent and clarified, not only in terms of assumption, but also in procedures. A clear strategy for reducing bias is interdisciplinary work, especially on complex issues like drug use. Scientific work is always a collective endeavor. And through self-criticism and critical debate, we can reach a greater rigor. In that sense, when we see public policy, academia always operates as a bridge between citizens and the state. It has a bidirectional role. Academia fosters connections between different sectors of society that, of course, they are seeking the common good. The authority of the academia as an expert, sometimes we could say that is undeniable, but this authority, how also Kathy mentioned, is also needs some legitimation. It's a constant exercise that they need to foster for that. In its role, especially of coordinating different efforts. One good example of this role of academia is what happened with the working groups within public agencies. In Latin America, we call it mesas de trabajo, for example, that many institutions, governments, they're fostering. And one example in Colombia, that we have the technical working group of the pharmacovigilance groups, where especially Professor Pérez-Acosta has been participated. And this working group was supported by the National Institute of Drug and Food Surveillance in Lima in Colombia. So these kind of examples are quite relevant. But what happens when we have misinterpretation, of course, especially that we said that search, that when we talk about this academic reflection, there's a lot of data makes sense with interpretation, but it could happen this, and especially in health context. We have two examples about the case of glyphosate spraying in Colombia, and also like the well common opioid crisis and oxycodone. So in the first case, glyphosate has been used as a herbicide in '92 and promoted by companies like, you can see there, like Bayer Monsanto, and also as part of Plan Colombia. In 1999, this strategy became was implemented to combat drug trafficking and armed insurgent groups. However, in 2016, the International Agency for Research of Cancer classified the glyphosate as probably cancerogene to humans. So today in Colombia, there is a polarized debate about its use, since due to the role it played in Plan Colombia, its rejection is often understood like like a support to the proliferation of illicit crops. So this polarization marks a clear misinterpretation in the scientific facts. In the second case that we mentioned there, in the second case, well, we said the deliberate concealment of information by Purdue Pharma regarding the prescription of oxycodone for many years. This misinterpretation in this case was purely due to economic interest. It's very sad, which ultimately led to a public health strategy related to the use of legal prescription opioids. So in these both cases, we can see that the misinterpretation of scientific data is not due to being naive most of the time, but also related to interests that were not made transparent as they should be. So, but to prevent this such cases and to avoid misinterpretation, it's quite relevant to promote rigorous research, and in the academia, that also we were discussing with Professor Pérez-Acosta, that we need to promote scientific communication as a key factor in making stronger ties between citizens and the states. Scientific divulgation must be appropriate for both the public and the government bodies. Similarly, promoting scientific literacy helps for bridging the gap between the scientific community and the public. What is at stake here is that academia is not an elite of experts. Scientific work only acquires value if it provides the service and utility for which it is required. This demands establishing a strong tie with society as a whole. Always it should be in dialogue. As a final thought, we emphasize the need for methodological rigor in public debates. In academia, we understand that scientific facts cannot fully grasp the complexity of the phenomena and the investigation. We're constantly getting closer to understanding that complexity, but we cannot encompass it completely. That is why scientific evidence, especially in public health matters, is treated in probabilistic and statistical terms. We're not talking about the truth here, we're talking about scientific work. In this way, by clarifying methodological rigor of each investigation, polarization in public debates, it may be avoided, and it's created a space for promoting agreements and collaborative work for the common good. Thank you so much for your attention, and also to the support of Professor Pérez-Acosta.
Thank you so much for that presentation. It really strikes me that right now we live in a society with social media and other easy access to purported information. And sometimes we see outrageous claims being made that are far from the truth. And so it's a really good reminder that even though there is scientific evidence and data and rigorous study, it's not always available to the people that are influencing policy or stating strong opinions about policy. And so it's a great reminder that academia is that bridge. It's that trusted partner that can help us understand the information that we need and would need to be a basis of drug policy. So thank you for bringing that to light for us. And our panel will finish up today with Martin Díaz, who is a founder of Knowmad Institute, a theologian and social researcher focused on scientific knowledge governance, open science, and human dignity. His work centers on traceability, provenance, and the responsible reuse of scientific information to support decision-making processes and multilateral environments. So with that, the microphone is yours.
Thanks. So thanks, Tuukka, Katherine, David, for your presentations. The reflections shared in this panel highlight several interconnected dimensions of evidence-informed policymaking. Institutional capacity shapes how monitoring systems works. Human rights frameworks depend on credible scientific knowledge, and public debate require the careful interpretation of complex research findings. Yet, one structural element often remains largely invisible: the infrastructure that connects research, production, access to evidence, and policy dialogue. My intervention focuses on this structural layer: how open research infrastructures can help organize access to scientific knowledge in ways that stretch multilateral policymaking. In global governance, the main challenge is rarely the absence of research. Across universities, public agencies, and international organizations, enormous amount of scientific knowledge are produced every year. However, this knowledge is distributed across thousands of repositories, journals, and research databases that rarely communicate with one another. For policymakers, this fragmentation creates a practical barrier. Comparing evidence across countries, disciplines, or regulatory environments become difficult when the research landscape itself is structurally fragmented. As a result, policy discussion often rely on partial snapshots of available knowledge rather than coherent overview of broader evidence ecosystem. This is where knowledge infrastructure become essential. Producing research alone does not guarantee usable evidence policymaking. Evidence systems require structured environments where research can be compared across institutions, disciplines, and policy contexts. Open science improves access to knowledge, but access alone does not necessarily create coherence. Knowledge infrastructures play a different role. They connect dispersed research outputs into structured environments where relationship between publications, institutions, and policy systems become visible. In this way, knowledge infrastructures help transform fragmented research landscape into a comparable policy evidence. To illustrate how this approach works in practice, we developed a curated research collection focusing on international drug control architecture and illicit drug markets. The database brings together more than 3,000 scholarly works spanning multiple disciplines, including public health, criminology, international law, and economics. All research inputs are open access, and we are creating a tool to collect only open access research, because the barrier is not only this kind of silos that Tuukka say, but also the firewall of this research. So to reduce this gap, it's important that the researchers in the countries that have less resources can have access to the same data, to the same knowledge. And it's not only about the paywalls, but also about the language and the barrier in the language. And now with artificial intelligence and other tools, we can superate these barriers with technology. The systems also maps research outputs to the United Nations Sustainable Development Goals to be a database, policy-ready database. So this can relate and score each research input with the SDGs and also with ESG scores. Ultimate evidence-informed policymaking depends not only on producing research, but also organizing access to that knowledge. Open science improves knowledge infrastructure, improves comparability. When evidence becomes comparable across contexts, in strength transparency, policy legitimacy, and international cooperation, public research infrastructure, so like this, like the Knowmad Research Gateway, like we create, and to contribute a shared global evidence ecosystem, one that helps transform fragmented research landscape into structured knowledge environments that support more informed and transparent multilateral decision-making. We invite you to view our booth or scan the QR, that QR, I have it there. If you are interested in explore the gateway, and thank you very much.
Thank you, Martin. I had a chance to do some exploring yesterday, so I had a little bit of a sneak preview, and it is so impressive. I know whether I'm doing a traditional Google search or turning to AI or talking to colleagues, this vast amount of information with linear relationships is not really sufficient to build our policy and our implementation. But this interrelational database, it's very intuitive. You click and you see more relationships. It's a great resource. I'm excited. I think today's a big unveiling more officially. So please take a chance to look at that. And it really culminates in all the things that our panel has been talking about. So congratulations on doing that.